Welcome to NEDA's Excerpts from the Experts, 7-minute learning sessions with researchers and practitioners in the field of eating disorders, and individuals and families who share their experiences and perspectives. I'm your host, Sarah Bowie-Keaton. This week, our guest is Doug Bunnell. He's a clinical psychologist with over 40 years of experience in the eating disorder field as a private practice therapist, a clinical supervisor, clinical executive, and chief clinical officer. He is a fellow of the Academy for Eating Disorders and certified eating disorder supervisor for the International Association of Eating Disorders Professionals. Today, Doug will be speaking with us about eating disorder treatment and what that should look like. Doug, welcome to our program. It's a pleasure to have you.
Oh, thanks so much for having me. One of the challenging things with eating disorder care is that it's not usually just one person or one provider. So one of the more daunting tasks is constructing a team of providers. So, average expectable situation, you're going to need a psychotherapist, a physician, sometimes a psychiatrist, often a nutritionist. Sometimes there's a family therapist that's different than the individual therapist. So that can be really challenging. And one of the questions I actually ask and want parents to feel empowered to ask of a new provider or provider they're sort of engaging with is like, do you have a team of people you work with? Can you help me construct the treatment team? People come into treatment in different ways with different, sort of levels of acuity or risk or urgency. But certainly it's very important, no matter how they come into treatment, that there be a physician involved in some way, like someone is checked off on the medical piece of it. But often, most times I'll say the psychotherapist is the team leader on these things, because psychotherapy is, for the most part, the core treatment for eating disorders. So if you've managed the medical issues and some of the urgent nutritional issues, the lead clinician is usually the psychotherapist. What I'm cautioning against is, even if you find yourself into treatment that way, one of the first detours would be to a physician to really make sure that the psychotherapist is sort of aware of what the current medical issues are.
Okay, good point. So what are some things to look out for when someone's selecting their treatment providers?
So this is where it gets complicated. And what I'd like to say is that there are clear standards for, that designate people or mark people who are eating disorder specialists. There really aren't a lot of certifications for that, with one exception. The International Association of Eating Disorder Professionals, or IADEP, does have a certification for psychotherapists and nutritionists and physicians. So if you were interviewing someone who has that credential, you can be pretty confident they've got more than just a basic knowledge. They've actually done some specialized training and have a background of current information about best practices in treating people with these disorders. Families and patients need to become educated consumers. They need to go out and use resources like the NEDA website and the wealth of information there. And actually, they can find a list of questions on the NEDA website to ask a new provider. One of the things I like to really push parents to feel empowered to ask for, and patients, individuals too, is like, what do we do if plan A doesn't work? Like, let's think ahead right now. How will we know? How long are we going to go with plan A before we sort of move to plan B? And plan B could be a more intensive treatment, a different type of treatment, adding in other consultants, or adding a dietitian in if one's not involved, or getting a psychiatric consultation if medication might be helpful. But I want families to know that there's more than one step to this, and just getting into therapy is not often the end point to that. I like to say the expectation for a family member and individual should be that some change should happen pretty quickly. If nothing's happening at all after, pick a time, 3 months, whatever, that's probably time to change something. But it may not be at the end of 3 months, everything's fine, but there should be some progress being made. And if not, if that things aren't shifting, then families and individuals should feel really free to say to their clinician, What's the deal? What are we missing? What else should we be doing?
So treatment should be dynamic. You should be seeing some progress, and it could take some time, but within 3 months, if it seems static, ask some questions, continue with that advocacy, empowerment.
Absolutely. And for families, with younger kids, even adolescents and younger adults, asking very clearly, what are your clinicians' expectations about my role, the parent's role in this treatment? Before decisions made to start or really commit to treatment, you should expect, again, respectfully, you should expect a pretty full description from that clinician about what the immediate issues are, the immediate focus of treatment, and what that's going to be. Usually that's on helping people restore nutritional balance and to regain weight or stop binging and purging, but sort of immediate symptom stabilization. But you want to get a fuller description of what else is going on here that we need to be attending to. And what's the 1 year or 2 year outlook on how my kid's going to progress through this. And can you really tell me what else might be going on here? I worry sometimes, and this is a much bigger issue, but it's people have eating disorders, but often there are also other issues going on with anxiety or mood or substance use or experiences they've been through, or really other disruptions in their well-being. And we can miss that sometimes. Being a family member with someone with an eating disorder often means you have to feel things and address things that may be difficult for you. It's scary. So you want to make sure I, as a clinician or programs that I'm involved with, really need to pay some attention to how we're meeting the emotional needs of family members.
Good to know. Very, very helpful information. I really appreciate your time today and sharing what families are going through, how to approach treatment, and what that kind of looks like.
My pleasure. Thanks for doing this.
Thanks, Dr. Bunnell. NEDA's mission is to support individuals and families affected by eating disorders and serve as a catalyst for prevention, cures, and access to quality care. NEDA offers programs and services designed to help you find the help and support you need. Whether you have been personally affected by an eating disorder or care about someone who has, recovery is possible, and we're here to support you.